is Leonardo Bedoya, and I will be showing you today 5 stretches for the lower extremity, one for the Iliopsoas, the Rectus femoris, proximal hamstring, distal hamstring, and the Gastrocnemius. So some of the benefits for stretching the hip flexors and extensors are to decrease low back pain, to decrease the risk for injury in sports, and to increase stride length, as well as to reduce some excessive anterior pelvic tilt from the tight flexors and posterior pelvic tilt from the extensors. Another benefit of stretching the calves or the rectus femoris could allow somebody to do a full squat without lifting their heels. So for the first stretch, we're going to focus on the rectus femoris. You're going to hold on to something in front of you for sturdiness, and then a couch right behind you. You're going to place the leg that you're going to stretch onto the couch, and all you're going to do is squat straight down, making sure that the hip is perpendicular to the ground. So all you're going to do is flexion of the knee as much as you can. You can lean back if you can, and you should feel the stretch in the anterior part of the thigh. Now again, making sure that the hip is perpendicular. Okay. For this next stretch, we're gonna stretch the psoas. So we're gonna get a rolled up towel. We're gonna put it mid anterior thigh, which creates a slight hip extension, so it puts more emphasis on the psoas. You're gonna get a strap. You're gonna put it around the ankle, and all you're gonna do is pull. And you want to avoid lifting up the pelvis off the floor. So just pull, and you should feel stretch in the anterior proximal thigh. Right. In this next stretch, we'll be stretching the proximal hamstrings or glutes. So the patient will be supine, the untested leg will be bent, and the tested leg, you want to bring it to 90 degrees of hip flexion, and then in this same position, you want to extend the knee slowly until you feel slight firmness, so right about there, and they should feel it right there, and they should feel it more in the proximal hamstring or glute. Now to test the distal part, bring it slightly forward, slightly in extension, extend the knee fully, and just bring it up as much as you can go, so right about there, and they should feel it more in the distal part. Now to put emphasis on the gastrocnemius, in the same position, just dorsiflex the ankle as much as you can in full extension, and making sure, and they should feel it right about here. So in conclusion, when you perform these stretches, just make sure that you perform them in a sturdy surface, as well as to avoid any compensation from any other joints. Thank you.